Welcome back, everyone. So happy to have you today. We're talking about a chronic disease that affects 176 million women worldwide. Dr. Jeremy Groll joins us now to discuss Endometriosis Awareness Month. How are you? Welcome.
Oh, thanks. And yes, and as you said, millions of women, suffer from this, horrible
I am
disease.
one of them. I will say I suffer from it myself.
And, it is such a wide range because some folks, may have really debilitating symptoms that put them out of work or may have, invasive procedures. Other women have absolutely no symptoms and would never know that they have it. And so meanwhile it smolders and gets worse. And so being aware of, the disease, it's surprising how many women I see. Now we bring this up and they're like, what's that? And, when so many people have this either from, painful periods or in delay in getting pregnant.
Yeah.
And so that when we look at folks, say, with unexplained infertility, that actually 30 to 50% of those couples may have endometriosis in the woman. And it's a disease where the tissue that normally gets passed with the menses actually gets up into the abdomen.
Okay.
And so little implants attach, and then that grows and breaks down and grows and breaks down each month with your cycle. And there's no place for it to go. And
we're seeing some symptoms up on the screen there. This is just a few of the things that you might have if you are suffering from endometriosis.
That's exactly right. And because, of that breakdown, there's a lot of inflammation. And so that women can have painful periods. They may have, just chronic pelvic pain. A lot of folks actually get unrelated symptoms. They'll have problems with their bladder or using the bathroom, and so they may have pain either with a bowel movement or voiding, and that a lot of times those other organ systems actually get ignored. And so real important to always look at some of these other symptoms, be it urinary or from the GI effects, because there could be endo hiding in these other places as well. And if we don't address all the disease, then we don't get a complete, resolution. Sure. And a lot of folks think that the only way to cure this is to do a hysterectomy.
But that's not the case. There are some great treatment options that you have as well.
That's exactly right. And so there's some kind of classic treatments, things like birth control pills and such, which work very well for a lot of women, especially if their primary symptom is, a painful period. Then we can make them not have a period or reduce those. But there are other suppression medicines and treatments. There is a newer protocol where we use a combination of medicine, and they had a study where basically they had women with stage 4, advanced disease, and they looked again 12 weeks later, and they found over 90% of them had no evidence of disease after that treatment. And we've had folks who then were, sworn that they would have to have a hysterectomy someday, who we have on long-term management and doing very well with minimal side effects. So
very good.
Great options for people, whether it's for trying to get pregnant or for people who are done having children or not interested, that ways to manage their symptoms.
Very good. Dr. Groll, you always have great information. If you are suffering from this or you saw some of those symptoms that look familiar to you, visit SpringCreekFertility.com or visit Dr. Groll there in Centerville. He can help you out. Thank you so